me, because it's that gross. So I have one person who likes buttermilk. Is my buttermilk person here? There we go. You'll drink your own buttermilk. Okay, so we need that, and then a puree, which can be like a yogurt, an applesauce, a pudding, something like that, okay? So don't forget those things, and most importantly, very importantly, bring your diagnostic independent study list so that I can sign that off for you, okay? Here I can sign that off for you. Because of that error, well, not just that, there have been a few changes in the syllabus as we've gone along. So just to review for you guys where we're at, okay? Because I've kind of reorganized a couple of things. So obviously we finished the A&P and the normal phases, and you were tested over that, and I won't test you again on that in the final, okay? So from there, we talked about swallowing disorders, right? Then we talked about how we're going to evaluate those disorders. Now we're on to therapeutic interventions. We started that on Tuesday. How do we intervene when our patients have some sort of swallowing impairment that they need assistance with, right? So that's where we are now. We have a couple of things left to do. We want to talk about, we're going to do our oral meds. We're going to talk about dysphagia and respiration a little bit, some ethics stuff, and hopefully today, if we have time, I'm going to talk to you guys a little bit about documentation, and we're going to try a few cases today. So I've moved the case study stuff up a little bit on the syllabus. I think I have it for next week. Okay, so that's kind of where we are. So we've gotten through a lot of material. So on Tuesday, we left off talking about, we had started by talking about the kind of general areas, right, where we can categorize therapeutic intervention for dysphagia. We talk about compensatory strategies, we can talk about diet changes we make, and then exercise for facilitation. And if you remember, when we compensate, we're trying to compensate for the impairment or weakness or for the problem. We're trying to find a way the patient can compensate for it. When we're doing exercises or facilitation, we're trying to actually improve function of whatever the weakened muscle is or whatever the disorder is, okay? So like if they have weak laryngeal elevation, we're going to try and improve their elevation. So that's the difference between compensation and exercise. Okay, so we talked about seating a little bit, we talked about different kinds of positions. You know, I have an very interesting seating story just from my dysphagia clinic yesterday, because I always talk about how important this is. And yesterday we did a dysphagia on a young girl. She was 19, and she could not sit up straight in the chair. We have this big pink chair that they sit on, and she kept sliding it, even though we strap people in there. We can strap around their torso, we strap around their legs. But she kept sliding, and I kept saying, she's sliding out of the chair. And people were, yeah, she is. And then finally, I'm like, she's going to fall out of this chair. And then they're like, ooh. So we had to lay her back flat, and we had to do the whole 1, 2, 3 and pull her up. We probably did that 2 or 3 times to try and get her to be able to stay upright in that chair, or at least close to upright. And then finally they had to get an additional strap because she just sort of kept doing this, like she's in the chair, but she kept like going this way, you know? And I kept trying to pull her up, but she kept trying. And this was before the test even started, of course, right? Because I'm trying to get her positioned. So it is really important. I mean, we couldn't even start the study because we couldn't get her in a situation where it was even safe for us to administer a trial. Okay, so then we talked about a couple of postures: chin down, head rotation, back, tilting your head back, side. Talked about sour bolus, placing the food. Normally you put food in the middle of your tongue, right? But if you have some sort of impairment due to either cranial nerve damage or resection or that sort of thing, sometimes you have to place the food differently and not right in the middle. Then the external cheek pressure, because that should help if you've got, let's say, low tone, right? To make sure that the patient isn't pocketing. And that's where we left off. So, okay, so labial support refers to people who have poor lip seal. And when patients have poor lip seal, sometimes you can either teach them to, just take an index finger and compensate by holding up their lip, their bottom lip. Sometimes the lip seal is also due to, sorry, I'm trying to get my right notes. Sometimes there is also the issue of not having some trigeminal damage, let's say, and they're going like this. So you've got the open jaw, so now you need labial and chin support, in which case, let me think, there's a way. Let me look. I can't remember. Position thumb along mandible, index finger beneath the lower lip, and middle finger. Wait a second. Thumb along mandible. Look at there, right? Index finger beneath the lower lip, and middle finger beneath the chin. What's going on here? I think it's like this, maybe, like this. So that you have this middle finger here, and then the thumb behind it, and the index finger below the lower lip. So that you can help push and hold that chin up. Right? Because I'm talking at the same time, but essentially you have food in the mouth, and then that way the mouth can stay closed. And the lips can, with this finger, get sealed. That makes sense? Okay. I'm not funny here. Okay. So that's kind of the whole, so you would, for just the labial support, you could just use that index finger, close the lips. For the chin support, you would want to place fingers below the chin. And then for both, you would do thumb